Hello everyone, very good morning to all of you. So today let's talk about cardiac physiology. Okay, so we are discussing about the previous year concepts in the morning, and I'm going to discuss the questions, that is MCQs, in the evening. So you just read or get to know about the concepts in the morning. We will apply that in the evening. Okay, so cardiac physiology. So we all know that the heart, it receives the oxygenated blood as well as the deoxygenated blood. Okay, so I'll just mark the parts of the heart, the cardiovascular system, so that it will be very easy for you when I use the terms like AV valves or semilunar valves, or the blood pumps from the superior vena cava, inferior vena cava. Okay, so now moving, so this is the right atrium. Okay, and this is the right ventricle. So any atrium or any chamber of the heart is usually separated by valves. Okay, in this case it is a tricuspid valve. So right atrium, right ventricle. Similarly, left atrium, left ventricle, and these two are separated by what is called as the bicuspid valve. Very simple, right? So right atrium, right ventricle, left atrium, left ventricle, tricuspid, bicuspid valves. So these are otherwise called as AV valves. Okay, now these right atrium and right ventricle, it has to pump the blood to the arteries. So in this case, it pushes to the pulmonary artery. And the left atrium, left ventricle, it pushes the blood into the aorta. So as I told you, any chamber, it will have valves. So right ventricle and the pulmonary artery, they are separated by a valve called pulmonary valves. And the left ventricle and the aorta, they are separated by aortic valves. And these two, they are called as semilunar valves. Okay, so this is the very basic. So the heart receives the blood, especially the right side of the heart receives the blood from the inferior vena cava, the superior vena cava. Okay, it receives the deoxygenated blood. The right atrium, it goes to the right ventricle, it goes to the pulmonary artery, it is carried to the lungs. Whereas on the other side, if you see, we have what is called as the pulmonary veins. So the pulmonary veins will bring the blood to the heart. It carries the oxygenated blood and it is pumped via the aorta to the other parts of the body. So this is how the heart gets receives the blood. Always remember, the valves will open in one way. Say for example, the right atrium, right ventricle as a tricuspid valve. The left atrium, the left ventricle as bicuspid valve. So only when both the valves open, the blood will come down. It is not like right atrial that is the tricuspid valve will open and then later bicuspid valve will open. No, it is a one way. The valves will open one way. So when I say the blood enters from the atrium to the ventricle, it is from both the right and the left atrium. The blood enters to the right ventricle and the left ventricle. Similarly, when I say the blood enters into the arteries, it enters into the pulmonary artery and the aortic valves. Okay, so the valves are open one way. Okay, so this is the very basics of the heart. And also, if you see, heart is slightly bigger on the left ventricle side than the right ventricle side. Why? Because the left ventricle is nothing but myocardium. Okay, the muscles is more on the left side, left ventricle, because the blood has to be pumped by the left ventricle into the aorta. Okay, the majority of the blood will be pumped by the left ventricle into the aorta. So more pressure or more energy is needed in that area. It is distributed to all over the body from the head to the toes. So more amount of pressure is needed there. So that is why you see more amount of muscles there compared to the right ventricle. Whereas the right ventricle, it has to pump the blood only to the lungs. It is very near to the heart. That is the reason you see a little bit less muscles compared to the left ventricle. So the heart has epicardium, endocardium and myocardium. So endocardium is very important because it lines the chambers of the heart. Okay, it lines the chambers of the heart. So what is the function of this endocardium is it is responsible for the smooth blood flow. So the blood flow will not be turbulent. So endocardium is responsible for smooth blood flow. It lines the chambers of the heart. Okay. And myocardium, as I told you, it has muscles. Epicardium, it lines the heart, outer it lines the heart in the outer surface. It has coronary vessels. Okay. And also we have what is called as the pericardium. So pericardium is basically a sac which protects the heart. Okay, so pericardium is a sac-like structure which protects the heart. So this is the very basics of cardiovascular system. So if you get familiarized with this, whatever I'm going to tell will be very easy for you. Okay, so right atrium, right ventricle, it has tricuspid valve. Left atrium, left ventricle, bicuspid valve. The valves open one direction. Okay, so blood will enter from the right atrium, left atrium to the right ventricle, left ventricle. At the same time, the semilunar valves will open, the blood will enter into the pulmonary artery and the aorta. And it has epicardium, endocardium, myocardium, and also it will have a protective sac called pericardium. Okay, so with this we'll move into the cardiac cycle. Okay, so if you know this, whatever I'm going to tell you in the cardiac cycle, it will be a cakewalk. Okay, so moving on to the cardiac cycle. So cardiac cycle, the first phase, what I'm going to call, is called as the ventricular filling. Okay, ventricular filling. So what happens? The body, it receives the blood, that is the right atrium and the left atrium. It receives the blood from various parts or various parts of the body through the inferior superior vena cava and the pulmonary veins. So what happens? The blood enters into the superior vena cava, inferior vena cava, and there is enormous amount of blood entering into the right atrium, and the blood enters via the pulmonary veins. Enormous amount of blood is gathered in the left atrium. Okay, so because of this, what happens when the pressure increases? Obviously, see, say for example, it is like a balloon. When I pour water into the balloon, the pressure increases. At some point of time, it will burst. Okay, similarly, a very simple concept of blood flow is blood will flow only from areas of higher pressure to the lower pressure. Okay, so when the right atrium has a higher pressure, obviously the valves is going to open, the blood is going to enter the ventricles. When the left ventricular pressure is more, then the blood will enter into the arteries, that is a pulmonary artery and the aortic artery. So in this case, the ventricular filling, so the body receives the blood, especially to be specific, the cardiovascular system receives the blood from the superior inferior vena cava and the pulmonary veins. Blood gets accumulated in the right atrium and the left atrium. So what happens? These valves, they are going to open, and there is going to be passive, no pressure, okay, passive filling of the left atrium, sorry, left ventricle and the right ventricle. So 70 to 80% of the blood is pumped from the right atrium and the left atrium during the ventricular filling. So the pressure increases, the valves open, there is a passive flow of blood from the right and left atrium to the right and the left ventricle. So this phase is called as the ventricular filling phase. So in this phase, now you are going to tell me, see, I'll tell you a very simple way to distinguish between a few terminologies which will be confusing. Atrial and ventricular pressure. Okay, atrial, right atrium and the right ventricle. Atrium means right and the left atrium, not the arteries. Okay, so atrial and ventricular pressure means right atrium, left atrium versus the right ventricle and the left ventricle. Arterial and ventricular pressure is arteries, the pulmonary artery, aortic arteries, and the ventricle. So it is between the pulmonary, the aortic artery and the pulmonary artery versus the ventricles. Okay, so atrial, right atrium, left atrium versus the right and the left ventricles. Arterial versus ventricular is the pulmonary aortic artery versus the left ventricle and the right ventricle. AV valves. What are AV valves? Obviously, it is the tricuspid and the bicuspid valves. Semilunar valves. Semilunar valves are pulmonary aortic valves. And what do you see in the EKG? Very, very simple. You are going to answer it. Okay. See, the atrial versus the ventricular pressure. Now, looking at this diagram, you have to tell me whether the atrial pressure is more or ventricular pressure is more. Obviously, the atrial pressure is more than the ventricular pressure, right? That is the reason the valves open, the blood enter into the ventricles. So atrial pressure is more than the ventricular pressure. Now coming to the arterial pressure and the ventricular pressure. So see, if the arterial pressure is more, what will happen? The blood will move from the higher pressure to the lower pressure. That is the concept, right? So imagine the atrial pressure versus the ventricular pressure. If you see, the atrial pressure will be higher than the ventricular pressure. Okay, it will be higher than the ventricular pressure. Why? Because if it is less, then the blood will come again into the ventricles. So the atrium, the pulmonary artery, aortic artery, the pressure will be more. Okay, the pressure will be more. That is why the blood will not enter at this point, at this ventricular filling phase. At this ventricular filling phase, the atrial pressure will be, sorry, the arterial pressure will be more. The blood will not enter from the ventricles to the pulmonary artery or aortic arch. Okay, now what happens to the AV valves? AV valves, they open. That is how the blood enters into the ventricles. So it is open. The semilunar valves, they remain closed. Why? Because the atrial pressure is more than the ventricular pressure. Only if there is a pressure drop in the atrium, or if the pressure in the ventricles is more than the pressure in the pulmonary artery and the aorta, the blood will move up. Higher pressure, lower pressure. Okay. So semilunar valves are closed. And what do you see in the EKG? In the EKG, we see what is called as the P wave. Okay, so this is the first phase. This is the ventricular filling phase. Very simple. The blood enters from the inferior vena cava, superior vena cava, and the pulmonary veins. It reaches the right atrium and the left atrium, and because of the buildup of the pressure increases. The right and the left atrium has more pressure than the right and the left ventricles. So the valves open. There is a passive filling of the blood into the ventricles, and then what happens? There is going to be ventricular filling, passive 70 to 80% of the ventricular filling. This is the first phase of cardiac cycle. Okay, now moving on to the second phase. So what happened in the first phase? There was a passive filling of the blood, right? Okay, now imagine blood has flown from the right atrium and the left atrium into the ventricles. And now what happens? The myocardium, the muscles, they start to contract. Okay, so the contraction of the muscle takes place. So when it contracts, the pressure increases. I'm just squeezing this area. See, imagine I'm just squeezing here. So when I squeeze here, the pressure is going to get increased. Okay, so the pressure is going to get increased. This phase is called as the atrial contraction. Sorry, isovolumetric contraction. So it is isovolumetric contraction. Okay, so in isovolumetric contraction, what happens? The ventricles, they squeeze, they contract, the cardiac muscles, they contract, they undergo depolarization, and the contraction takes place. Okay, so what happens? The pressure increases. So because the pressure increases, what happens? It is going to shut the AV valves. Okay, so the pressure increases, so the right atrium is going to have decreased pressure compared to the left atrium or the left ventricle. So the AV valves, they are going to get closed. So AV valve close. Why? Because they shut. So the blood in the left ventricle and the right ventricle, they build up more pressure that shuts down the valves. Okay, so the pressure is starting to build in the ventricles, the left and the right ventricles. So because of this increase in the pressure, the shutting of the tricuspid and the bicuspid valve take place. That is how we hear the first heartbeat sound, which is the dub, which is the lub. Okay, it is heard as S1. So lub sound S1 is because of the closure of the AV valves. Why the AV valve closes? Because the pressure increases, the contraction of the muscles causes the squeezing of the left and the right ventricles, that causes the shutting down or closing of the AV valves. So at this stage, the pressure is building. Okay, so now you can ask me whether it is more than the arterial pressure, that is the pulmonary artery and the aortic arch, or it is less. See, usually the aortic arch, it will have more pressure. Say for example, it will be around 80 mmHg, whereas the pulmonary artery will have a little bit of lesser pressure compared to that. It is around 10 mmHg. Okay, so at this stage, the isovolumetric contraction, the pressure inside the right ventricle will be around 7 mm and the left ventricle will be around 60 mmHg. Now you have to tell me, is the pressure in the arterial area is more or the pressure in the ventricular area is more? Obviously, the atrial pressure is still higher than the ventricular pressure. Now you have to tell me, will my semilunar valves open? No, because the arterial pressure is more and blood will flow only from the area of higher pressure to the lower pressure. Okay, so as long as the ventricular pressure increases, the semilunar valves is not going to get opened. Okay, so now atrial versus ventricular pressure, obviously the atrial pressure is more than the ventricular pressure. And now what happens to the right atrium and the right ventricle pressure? It is going to get dropped. It's almost going to get zero. So the right atrium versus the left right and the left atrium versus the right and the left ventricular pressure, if you see, the atrial pressure will be less compared to the ventricular pressure, whereas the arterial pressure is going to be more than the ventricular pressure, right? So what happens to the semilunar valves? It is still going to be closed. In the EKG, we are going to see the QRS complex. So this is called as isovolumetric contraction. Okay, now moving on to the next phase. Okay, this is ventricular ejection phase. Okay, so what happens? As the name implies, the pressure is going to get increased in the ventricles, the valves are going to open, the blood is going to flow out. Okay, so now the blood inside the ventricles is going to build up lots and lots of pressure because of the contraction. So what happens? The pressure in the area, what I told you, aortic, it will be around 80 mmHg, and in the heart, pulmonary arteries, it will be around 10 mmHg. And now the pressure in the left ventricle will be around 120 mmHg, and in the right atrium it will be around 25 mmHg. So what happens? Because of the increase in the pressure, the valves, especially the semilunar valves, they are going to get opened. So what happens? There's going to be blood flow from the right ventricle to the pulmonary arteries and the left ventricle into the aorta. Okay, so this is what is happening in the ventricle filling phase. Ventricular ejection phase. Ventricle filling is the first phase. Okay, ventricular ejection phase. So first one is a ventricular filling phase, which is followed by isovolumetric contraction, which is followed by ventricle ejection phase. Right, so now what happens? The valves get opened. So what happens? The blood enters from the right atrium into the pulmonary arteries, right ventricle into the pulmonary arteries, left ventricle into the aortic arch. So you are going to tell me what is happening in this ventricular ejection phase. What happens to the atrial and the ventricular pressure? Still atrial pressure is 0, so it is less than the ventricular pressure. What happens to the arterial and the ventricular pressure? Arterial pressure is less than the ventricular pressure. That is when the ventricles, they eject the blood from them to the arteries. And what happens to the AV valves? They remain closed. And the SL valves, that is the semilunar valves, they open. That is why the blood enters into the pulmonary arteries and aortic arch, and still you see QRS complex. Okay, this is the ventricular ejection phase. Very simple, right? Now, the last phase is the isovolumetric relaxation. Isovolumetric relaxation. So isovolumetric relaxation. So basically what happened in the last phase? The blood starts to enter into the aortic arch and the pulmonary arteries. So what happened is, these aortic arch and the pulmonary arteries, they are extremely elastic. Okay, they will expand. They are extremely elastic. Okay, so what happens, as the blood starts, more and more and more amount of blood starts to enter into the pulmonary arteries and the aortic arch, the pressure inside builds up. So once it builds up, again there is going to be shutting or closing of the semilunar valves. So the semilunar valves close. Why? Because the pressure has taken more than the ventricles. So the arteries, the pulmonary artery and the aortic arteries or aortic arch is going to have more amount of pressure than the ventricles. So the valves shut or close. This we call it as the lub tub. Lub S1, here is tub S2. Okay, so we are going to hear the second heart sound, that is the tub. So because of the shutting of the semilunar valves, shutting of AV valves, S1, lub. Okay, fine. So the AV valves, again they remain closed. The atrial pressure is still less than the ventricular pressure. The arterial pressure is more than the ventricular pressure. That is why it shuts the valves. And in the EKG, we are going to see T wave. So we are going to see the T wave. This is isovolumetric relaxation. So this is about cardiac cycle. We have 4 phases. One is ventricular filling, isovolumetric contraction, and then which is followed by ventricular ejection phase, isovolumetric relaxation. So as I told you, once you know the basics of the cardiovascular system, it becomes extremely easy to correlate things out. And now let's talk about a few other terminologies in cardiac physiology. So with this we'll wind up. So we will talk about what is cardiac output. So cardiac output is the amount of blood pumped by the heart per minute. Okay, so it is the amount of blood pumped by the heart per minute. Okay, so how to calculate cardiac output is calculated by multiplying the heartbeat or heart rate, to be specific, into the stroke volume. Okay, so what is heartbeat? Heart rate is heartbeat per minute. Sorry. Cut. So what is heart rate? Heart rate is heartbeat per minute. Okay, so heartbeat per second is stroke volume. Okay, so stroke volume is the heartbeat per second. So heart rate is the heartbeat per minute. So usually the heart rate is around 75 beats per minute, and the stroke volume is around 70 ml per minute, which is approximately is equal to 5 liters. So the cardiac output is around 5 liters. So you should come across the terms what is preload. Preload is very simple. So we know that the blood is getting pumped by the veins, right? So the amount of blood that enters into the ventricles, the amount of blood that enters into the ventricles that causes the maximum stretch, okay, which you call it as end diastolic volume. So the amount of blood that enters into the ventricles is the preload. So imagine more amount of blood, the heart stretches more, the more amount of stretch that is causing more, that will cause more amount of contraction. More blood, more stretch, more contraction. So this is what is called as Frank-Starling's law. Okay, so Frank-Starling's law or Stirling's law. Okay, so more amount of blood enters, end diastolic volume, more amount of stretch, more amount of contraction takes place. So this is preload. What is afterload? Afterload is the amount of resistance the ventricles face to push the blood into the arteries. Okay, so imagine the blood enters into the aorta, pulmonary arteries. If there is more resistance, will the ventricles provide increased afterload? No. So increased resistance or increased afterload will cause a decreased output, decreased cardiac output. Why? Increased afterload means there is going to be increased resistance. Okay, so increased preload will definitely cause cardiac output, because preload is the amount of blood that is entering into the ventricles. So the more amount of preload, more amount of blood enters, more amount of blood enters, more stretch, more contraction, the blood is pushed more. But on the other hand, afterload is the amount of resistance felt by the ventricles. So if I say there is more afterload, there will be reduced cardiac output. So this is the confusing terminologies. Okay, so preload, afterload, stroke volume, heartbeat. So heart rate, beats per minute, stroke volume. So it is the amount of the blood that is pumped every beat. So it is usually around 70 ml per minute. Heart rate is around 75 beats per minute. So with that we calculate around 5 liters of blood is usually the cardiac output. So this is about the cardiac physiology, the very basics. So in the evening session, I'll be discussing about the previous year MCQs which are asked in the cardiac physiology, and I'll be telling about a few terminologies, few concepts which which you feel difficult. Again, we will revise and we'll have a quick revision of the concepts. So thank you so much. Have a nice day.